done some research on this knows that sickle cell disease is an autosomal recessive disease. You need two parents, both with some abnormal hemoglobin trait, in order to have a child with sickle cell disease. Now, sickle cell disease is a big title, and under that, you have four major categories. The majority of the people who have sickle cell disease have something called SS, which means that they have inherited the sickle cell trait from both of their parents. The other three types are least common, but you have SC, and then you have S beta 0 and S beta plus. So it's four different types of majorly in the United States that you see. Um, Sickle cell disease has been around a long time. When you think of where it came from, in Africa, we know that sickle cell disease has been in existence for at least 5,000 years. Um, but it was identified here in the United States back in 1910 when a young student from Africa who was studying dentistry came and was having severe pain, and the doctors noticed he was anemic. And when they did the laboratory test, they saw on the slide that his cells were sickled. And that's when they really started paying attention and doing some research. So here in the United States, 1 in 365 African American babies born will have sickle cell disease. 1 in 13 will have sickle cell trait. Among Hispanic Americans, it's 1 in 16,300. So the majority of the children born in the United States with sickle cell disease are African or African Americans. Um, so that previously, people looked at this disease as a Black disease. However, when you look at the demographics now, you can see that people all over the world can have sickle cell disease. So I've had patients who were Italian, who were Greek, who were from Saudi Arabia, who were from India. So it's not just people who are of African descent. And so who are they? They're the people that you see every day. They're teachers, they're doctors, they're lawyers, they're domestic workers, they're secretaries, they're whoever you can imagine, husbands and wives and entertainers. Um, I have one patient who actually has made like several movies. He's real famous out there in Hollywood. It's really cool to go to the movies and see one of my kids. So yeah, so there's a lot of things going on. Sickle cell disease, however, is a disease that has major complications. And these complications are the type of things that um, are not predictable. Because sickle cell disease is a blood disease and it involves the abnormal shape of the red blood cell, these red blood cells, as they flow through the body, can block the blood vessels, causing pain. It damages the blood vessel, and they're small, they're fragile, they don't carry oxygen as well. So that if you're not getting a good oxygen supply, then your body is not going to be healthy. So blood vessels leading to the brain that are blocked by sickle cells can lead to stroke. Blood vessels leading to the lungs and the heart that are blocked can lead to respiratory disease and cardiac disease. So just about anywhere on a person's body who has sickle cell disease is at risk for some sort of damage, because wherever blood cells flow, wherever there are blood vessels and blood cells are flowing, then the potential for damage is there. One of the hallmark of the disease is pain, and that first slide, the picture that you see, was drawn by a young man who wanted to express to his physicians what sickle cell pain felt like to him. Um, he did this picture, he was about 18 or 19 years old, and he wanted them to know because he couldn't describe in words and in numbers. You know, in healthcare, they say from 0 to 10, what's your pain? And most people cannot actually do that. So he drew this picture to let them know what sickle cell pain was like for him. So I'm gonna get back to the pain in a few minutes, but other things that can happen are problems with fever and infection. A bacterial infection for a person with sickle cell disease can be fatal. So if they have a temperature that's say 101, if they don't get immediate medical care, if that infection is caused by a bacteria, they can die within 4 hours. So it's very important. So, imagine as a nurse, me talking to a family and telling them that. That can be extremely frightening because you have to make sure you have the ability to get to the hospital at a specific time if your child gets a fever. And to realize that if you decide to wait, then you may lose your child. So the kids are on penicillin every day, at least until the age of 6, in order to help them fight infection should they get one until they're able to get to the hospital. Other things that people with sickle cell disease can have, little babies can have something called dactylitis, which is hand-foot syndrome, which is swelling and pain of the hands and feet. Doesn't have to be all extremities. In fact, it could just be like a finger or a toe, but it's extremely painful. And if your 6-month-old is having this, it can be very traumatic. Stroke is another thing. I'm sure that some of you have probably known or seen someone who has had a stroke, and stroke and sickle cell disease can be severe as well. And then another major thing is something called acute chest syndrome, which is basically the worst case of pneumonia you can imagine having. All of these things, as you can see, are traumatic. So you can imagine that for families who had children with sickle cell disease, their lives are never quite stable because they're always waiting for that next problem or waiting for something else to happen. So they need a lot of support, both from the healthcare system and from the mental health care system. Some of the current therapies that we use are like penicillin, um, folic acid, which is a mineral that helps them to produce red blood cells, and hydroxyurea, which has been found to really help with episodes of sickle cell pain and other complications. Uh, One of the things that helps a person with sickle cell disease is to have a lot of something called fetal hemoglobin. And fetal hemoglobin is what a baby has when they're still in the uterus. Because babies in the uterus don't breathe with their lungs. They get their oxygen strictly through their blood. So the hydroxyurea re-triggers the body's ability to produce this fetal hemoglobin, because when the baby's born, as soon as they take their first breath, the mechanism is cut off. So hydroxyurea re-triggers that mechanism so that they can start producing fetal hemoglobin, which carries a lot of oxygen and makes the red blood cell bigger. So the kids who take hydroxyurea tend to have less complications, which is really great. There's a lot of new medications that are coming up. They have medications that help to increase the hemoglobin, medications that help to decrease painful episodes. So all of these things are great with today's world. Now, when you think about pain in sickle cell disease, it is unpredictable. Most kids do not get any kind of warning that they may be getting ready to have a painful episode. So it's basically what we say is life interrupted. You have a plan, and that plan doesn't happen because you have now had a sickle cell incident. So the plan was to go to work, but you woke up in severe pain, so you can't go to work. Or the plan was that you have a social event to go to, but you woke up and you're having pain again. There's a vacation plan. There's the prom, graduation, weddings. I can't tell you the number of patients that I've had who have missed these important major life events because of their sickle cell disease. Things are unpredictable. Children who have strokes, their warning comes right as the stroke is happening. I remember the young lady who came home from school. She was 13, walked in the kitchen because her mom was cooking and said, "Hey, mom." And then it was like, my head hurts. She fell to the floor and she had a stroke. So things are very unpredictable. kids who have the acute chest syndrome where they have severe pneumonia and they can't breathe, or they end up in intensive care because they have to go on life support or whatever, because their lungs are failing them. Most of the time, thank God, during this era, a lot of these children who have these things end up going home. For instance, for kids who, for stroke, um, in the last 10 years that I was working at CHOP, I think we only had 2 major stroke events, which is really great because when I first started working there, they were like having strokes all the time. But now we have something called primary stroke prevention. So we do special testing, something called a transcranial Doppler that looks at the blood vessels in the brain. It's an ultrasound and can let us know if this particular individual is at risk for stroke. If they are, then we do interventions before the stroke happens. This has greatly improved the life of these children. Um, so prevention, doing preventive measures is what we need. Now, the emergency room and hospitalizations um, cause families added stress as well. Unfortunately, because sickle cell disease disproportionately affects people of color, that comes with all the discrimination and feelings that, or racism and biases that people have against people of color. So it makes for trust issues between the individual and the staff. People can go into the emergency room. This is mostly with adults with sickle cell disease, but as they become teenagers, it starts to happen too, that an individual can go to an emergency room having in the midst of a painful episode, and instead of being treated immediately, they're made to wait long periods of time. And then sometimes they're actually accused of not being in pain, but being drug seekers. And during this opioid crisis that we're experiencing here in this country, people with sickle cell disease have been targeted. But when you look at statistics, they are the least people who are actually having issues with opioid addiction. So it's kind of just like, depends on what you look like. So it's like they look like this, so this must be what's happening. There's a definite lack of understanding between uh, individuals with sickle cell disease and the healthcare system. And so we do a lot of talks on the fact that people need to learn how to be compassionate, how to understand. Individuals with sickle cell disease often quote distrust, biases, lack of healthcare, because in the United States, there are a lot of states out there that do not have care for adults with sickle cell disease. People who don't have insurance, people who don't have sufficient food, who don't have places to live. It's more than just disease. It's like a total problem with individuals with sickle cell disease. So we do a lot of work trying to take care of those particular issues. There are a lot of curative therapies now. We have bone marrow transplant, we have stem cell transplants. Both of those types of transplants need to be effective and to be safe, need to have donors who are identical matches to the individual with sickle cell disease. And that's hard to find because that requires a sibling who has the same parents, both of the same parents. And sometimes that's difficult to do. But we have been having a lot of success with that lately, and we're very pleased with that. The gene therapy is something different, and that's really where they take out one gene and replace it with another, and they, in order to cure the disease. Unfortunately, the major research project that was going on with gene therapy is now being stopped because an individual who is a part of that program developed cancer, and they're not sure if the vector they used, excuse me, for the research caused the cancer, or if the individual would have had cancer anyway. So that's disappointing because that was a really a great project that we see in the future being very effective and helpful. Um,
Cecil, I just cut in there for a moment. We have a little audio issue on our end.
Okay. Mhm.
But this seems like a good segue too to kind of turn it over to Dr. Lamberti. And
Yes, it is. Thank you.
I know Dr.